नाम पटेल टिंकल है और हम वलसाड़ से है, गुजरात से। और मेरे बेबी का नाम है द्विज पटेल। जब वो पैदा हुआ था, लेफ्ट हैंड के अंदर एक बॉन्ड नहीं था और उसका थंब नहीं था। तो फिर हम उसके इलाज के लिए गुजरात के वलसाड़ और सूरत हॉस्पिटल में पहुंचे उसका इलाज कराने के लिए, लेकिन वहाँ पे उसका इलाज नहीं हुआ। फिर सूरत हॉस्पिटल में हमें SRCC हॉस्पिटल के डॉक्टर बिपिन गांगुर्दे के बारे में बताया कि वो इलाज कर सकते हैं, वो हैंड के स्पेशलिस्ट है। फिर हमने डॉक्टर बिपिन गांगुर्दे से कंसल्ट किया, उसने बताया इस बीमारी के बारे में और इसका इलाज पॉसिबल है। तो फिर हम यहाँ बॉम्बे में आ गए और उसका इलाज स्टार्ट किया। उसने ये पूरे डिजीज कंडीशन समझाया कि क्या है और उसकी ट्रीटमेंट हो सकती है। फिर हमने उसका ट्रीटमेंट स्टार्ट किया। फिर उसका पहले पूरा बीच का पूरा हाथ मोड़ा हुआ था, तो फिर उसे प्लास्टर से सीधा किया। फिर उसको फिक्सेटर लगाया पहले ऑपरेशन में। फिर तीसरा ऑपरेशन किया, इसमें उसका एक बॉन्ड नहीं था तो उसे सेंट्रल में लाया, सेंट्रलाइजेशन किया। फिर उसका अभी थर्ड ऑपरेशन हुआ, इसके अंदर उसका थंब नहीं था तो उसके इंडेक्स फिंगर को थंब में ट्रांसप्लांटेशन किया, वो पॉलिसिलाइजेशन किया।
So I am Dr. Bipin Ghanghurde. I am a hand surgeon with special interest in pediatric hand. So Dwij Patel has a syndrome. Basically, he has a short neck and he has a radial club hand, that is deviated hand with absent thumb. When he came as a child to me, we diagnosed it as a radial club hand with absent thumb, and due to his syndrome, he had very short fingers and middle phalanx of the fingers were also absent. So we decided to treat this child in multiple stages. We explained this to the parents that he will require at least 3 to 4 stages to correct the deformity of the wrist first. Then after correction of the deformity, we had to make the thumb of the child, as the thumb was absent in this child. So how did we go in this process? Initially what we did in stage 1 was that we put a distractor. The distractor is a device. It is a device which is used to slowly straighten the wrist. So gradual distraction is done so that the wrist becomes straight. After the soft tissues and the wrist becomes straight, what we do is we do a definitive surgery for the wrist, so to maintain it is in a correct position. This procedure is called as radialization. So in this procedure, it is an open procedure. It is around 3 hours surgery and it requires very special anesthetist for the surgery, which are available in this hospital. And since the child was syndromic, we needed ICU backup. So this surgery, after removing of the distractor, we correct the deformity of the wrist and we fix it in a straight position. After the wrist is straightened, we give a chance to the child to heal. The wrist is straightened, we give it multiple splints to maintain the wrist in the straight positions. After 3 months of this surgery, now the final stage comes in which we make thumb of the child. How is the thumb of a child made? This thumb is made from the index finger. So this child has only 4 fingers and absent thumb. So what we do is we cut this index finger and we rotate it with the blood vessels, with the nerves, with all the structures, and convert it into a thumb. So why is a thumb necessary? Thumb is very necessary to do your normal function in your life. So even if a child or a person has 3 fingers, a thumb is very important for all the functions of his life. So what we did for this child was we converted the index finger into a thumb. Now this is the final stage of the surgery, and now recently the child has been operated for the thumb, and everything is good, and child is slowly starting to use the thumb. So this is the final stage of the surgery. After this stage, we will gradually review the child of his progress and the function, how he'll use the child. So the parents are very happy with the progress the child is doing, and now the child is slowly picking up objects after this reconstructed thumb and trying to live a normal life as others.
अभी इस हॉस्पिटल के स्टाफ और सभी ट्रीटमेंट भी अच्छी है और डॉक्टर भी कोऑपरेटिव है और स्टाफ भी कोऑपरेटिव है। अभी द्विज को अच्छा है और अच्छे से खेल रहा है, उसको कोई प्रॉब्लम नहीं है।